Georgia needs a new governor. As I've said many times on the campaign trail, and I'm going to give another reason today, thousands of children in Georgia don't have insurance, and that's why I proposed Peach Kids. Peach Kids is a simple program designed to help those families who make just a little bit too much money to qualify for help, or in jobs that don't offer affordable health insurance. As you all know, Governor Perdue is opposed to Peach Kids. Under the Perdue administration, unfortunately, the children who need Peach Kids aren't the only families falling through the gaps without health care. Right now, thousands of kids with long-term disabilities are being denied medically necessary health care due to cuts to the Katie Beckett-Deming waiver, and because of Purdue's rush to shift everyone onto the Care Management Organization program, or CMO program. I'm talking about thousands of families, some who are standing with me today, who have private health insurance coverage and coverage that does not cover their kids' needs. Their children suffer from long-term disabilities like cerebral palsy, Down syndrome, and autism. The Katie Beckett program is a federal waiver program that allows families with private insurance to access Medicaid funding because their children's medical needs are so costly, it is unlikely that anyone could afford to cover them, even with insurance. Governor Perdue tried to cut the entire program last session, and he has tried to cut it every year that he has been governor. I and members of the General Assembly worked to restore the Katie Beckett program in the budget. As you remember, Senate Democrats offered a floor amendment to the budget to add funds back to the Katie Beckett program. Unfortunately, Governor Perdue only funded it through the November election. And he still made the guidelines more stringent so that fewer people qualify. That's what I would call playing politics with the lives of Georgia's children. Right now, these families are facing the uncertainty of having to pay for as much as $5,000 a month in medical expenses. Let me repeat that. $5,000 a month in additional out-of-pocket medical expenses. And that's not all. The governor's move to managed care has affected several other specialty areas that have resulted in a loss of services to kids that are greatly in need. I've heard this most often from the parents and therapists involved in the Children's Early Intervention Program, a program designed by the Georgia Legislature and the Department of Human Resources to help kids like these behind me. Georgia families used to be able to access speech, occupational, and physical therapy, but not under Governor Perdue. One of those children is Xavier Lindo. His mother drove here today from Columbus along with Xavier, just like they came to the Houston County debate last week. I hope that you'll ask Xavier's mother about the personal details of his situation, because they are truly stunning and disturbing. But those are her details to share. But let me tell you one thing. One thing is very clear. Xavier is being denied therapy because someone, somewhere, has said it is not medically necessary, and that his family should be providing the therapy that he needs at home. He is suffering physically because he has been denied care that his doctors and physical therapists have continually recommended. What does Governor Perdue have to say about this? He says every child who medically requires therapies will receive them. Governor Perdue needs to come down here today and say that to Xavier, and say it to Xavier's mother, and say it to them in person? Why has Sonny Perdue denied care to these families? The answer is clear. He has denied these families to save money. One Georgia grandparent from Waynesboro wrote to me about her grandson who didn't breathe for the first few minutes of his life. After multiple surgeries, he has been hospitalized 24 times due to serious issues dealing with his lungs: pneumonia, bronchitis, asthma. All of this is before the age of 4 years of age. Today, his family doesn't understand why it takes 2 weeks to get approval for asthma medicine, something he desperately needs to breathe. Why? To save money. So how will we fix this? We will fix it by putting the children of Georgia first. The first thing I'll do is ensure that the needs of enrollees in the Children's Early Intervention Program and Katie Beckett programs are met. If that means we have to look at carving out these programs for these children with special needs and with long-term disabilities, then that's exactly what we will do. It only takes the stroke of a pen. Florida is doing it, Georgia can do it. Sonny Perdue won't do it, but I will. In his State of the State address early this year, Governor Perdue bragged about the $1.7 billion in new revenues that he enjoys. And he bragged about his fiscal management. He said, and I quote, "We took a hard look at every program and we cut those that we could do without." Governor Perdue needs to come down here today and say to these families, we cut what we could do without. The point of this press conference is simple. We need a governor with the right priorities, who makes the right choices, who works for these children, and a governor who works for these children. That's a governor that we don't have now. Let's look at Governor Perdue's priorities. Governor Perdue's choices are clear. First, Governor Perdue gave Georgia corporations a $1 billion tax cut, while we were losing 10,000 jobs at Delta, 2,900 jobs at General Motors, 2,000 jobs at Ford, and 1,400 jobs at Brown and Williams. A $1 billion tax cut. That was his priority. That was his choice. He chose corporations over these kids. And Sonny Perdue made a second choice. He had a second priority. With the help of his personal attorney, who serves in the General Assembly, Sonny Perdue gave himself a $100,000 tax cut while these children were losing their health care. During the House and County debate, I tried to pose a question to Governor Perdue, but all he did was chuckle and smile. So I'm going to repeat my question today, and I hope that you will take the few steps necessary to go across the hall and ask him the same question. Governor Perdue, explain to these families here today how you can take a $100,000 tax cut for yourself while taking away the care of these children. What kind of choice is that? What kind of priorities are those? How did you choose yourself, your family, over these families? Because that is exactly what you did. That tells you all you need to know about Sonny Perdue, his priorities, and who he works for. My priorities are different. I believe Georgians want a governor, and I believe that they need a governor who will wake up every day thinking about the people of Georgia, caring about the people of Georgia, and working for them. And if elected, that's exactly what I will do. And I will start out with these children. I'd also like